Now, almost half of us would be willing to pay for better NHS services. That's according to a recent poll. Around 40% say they'd be open to paying extra to have operations more quickly and get routine opticians checkups, as well as mental health appointments.
With 9 in 10 respondents saying that the health service needs reform, is it time to start paying for NHS appointments? What do you think, Tom?
Well, they do this in France. And it is not.
Again,
of course, it's not.
They do it in France. It's not an argument, Tom.
That's true. That's true. I might as well say, they do it in North Korea. It doesn't mean it's good. But I think the point here is that there are countries that sort of have almost a tokenistic payment, not covering the entire cost of that. You're not asking people to sort of, stump up all of those healthcare bills like people without insurance have to do in the United States. Instead, having a sort of little tokenistic barrier just to stop the time wasting, to stop people who go in to see a GP just to have a chat or because they don't really need to.
And maybe those who earn under a certain income could be exempted from having to
there are lots of
fee.
ways that you could implement it. But interestingly, this is what Rishi Sunak proposed when he stood to be Prime Minister back in the summer of 2022. But joining us to debate this now is the author and broadcaster Rebecca Reed, who says we should not be paying for these appointments, but also political commentator Russell Quirk, who believes it should be a service with payments, with shortcuts to better services for those willing to pay. Well, goodness me, Russell, you're the one who wants to change things. You go first.
I do. Look, we've talked long and for a long, long time about innovating in the NHS. In fact, even Labour's Wes Streeting talks a lot about innovating in the NHS. I think what we can't do in terms of improving it, and I don't think there's many people that believe that it doesn't need to be improved. What we can't keep doing is more of the same and also just sitting there with our hands out, or the NHS rather, sitting there with their hands out, expecting more and more money to be thrown at the NHS as if that alone is going to solve the NHS's problems. What we need to see is some change, some innovation. And I think if you end up with, dare I say, and I'm sure this will be thrown back at me in a second, a two-tier NHS, I think that is not only innovative, but it seems entirely sensible and practical for a couple of reasons. One, because it would effectively ensure that those that take the basic level of NHS services would actually have more resource, because obviously there would be other people that are taking, if you like, premium services. But the second reason, of course, Tom, is that there would be money provided by that premium service that then, of course, would go on recruiting more doctors, more radiologists, more nurses and more equipment, which surely is exactly what the left have been crying out for decades.
But Rebecca, wouldn't people just be effectively paying twice?
Yeah, I mean, it's strange to hear people saying, should we be paying for our GP appointments? We do pay for them. They're free at points of usage, but a very significant amount of your tax pays for it. And I agree that NHS reform is important, but I think we should all be equally against a system where you can have better healthcare if you earn more money. And also, I find it confusing to hear about this mooted as a new idea. If you want to pay to see a GP, you can. Like, over the Easter weekend, my daughter has asthma. I wanted to get an inhaler done. I didn't want to wait in A&E. I had the ability to pay £68 to go and see a GP very near my house immediately on the dot like that. This exists already. If you want to pay for it, you can pay for it. So the suggestion that it's to improve people's access is disingenuous. What people are really talking about is wanting to find ways to free up more money. And what I find really, really egregious is the idea that somebody would think, oh, is my child quite ill enough for me to stump up 75 quid to see a GP, and maybe decide not to take their child because they don't have that in the budget. That just isn't right.
Let's throw that right back to Russell.
Well, look, one of the other problems with the NHS is that I'm afraid because it is free of charge, there is no accountability within that organisation. There's also no accountability on the basis of there being no consequences for the public that uses it, which is why on the very rare occasion that I go into my doctor's surgery locally in Brentwood, I sit there on a Thursday afternoon watching the clock ticking in terms of the amount of people that haven't shown up for their appointments. So the last time I did that, I think on a Thursday morning, 85 people that week hadn't turned up. Now, if you were to charge people a nominal amount, that level of consequence and accountability would then eradicate that problem and actually ensure that waiting lists literally at a stroke of a pen, at a stroke of a new policy being introduced, as I'm suggesting, would actually shorten the time that it takes to get to the GP. So, I say again, what we can't be doing throughout this what is now going to be an election campaign over the coming weeks and months is simply to talk about there having to be more money for the NHS. I tell you, if we were all taxed more and the money went directly into the NHS, it would not improve, because the problem is not one of funding, it is one of efficiency and lack of innovation and lack of good organisation.
So are you suggesting that charging for GP appointments wouldn't put more money into the NHS? So you're saying on one hand, the NHS doesn't need more money, but also we should charge people for appointments. How do those two things tally?
So because money becomes an incentive, or rather a disincentive. So in that respect, it's not necessarily about the money. It's the fact that it would create shorter waiting lists for GPs. I'd also go further, frankly. You won't like this very much. I would say that if you want to jump the waiting list for an operation, you should be able to pay for that privilege too.
You can. You go private.
Let me
but within the NHS.
Let me
Why
put
not
this
within the
to
NHS?
Let me put this to Rebecca quickly. So you say that you paid £60 odd, and it is possible for people to go and pay for a GP's appointment. There are many people who wouldn't be able to do that, and the suggestion is that the fee would be much, much lower. If that were to help clear the NHS backlog, stop time wasters from using up NHS resources, would that not be something that you would be in favour for if it were to actually help people have better access to the NHS rather than what we have now, which is almost a universal lack of healthcare?
But I think it's the freedom of choice thing that's great, right? If you have the ability to pay, then I think you should take it upon yourself to do so. I think that's a very responsible thing to do. But making it so that people don't have that choice, people's income fluctuates. I might be able to afford something this month that I can't next month. So having that freedom of accessibility is really, really important. But the idea, again, that your access to healthcare should depend on your budget per month doesn't make sense, especially if you were already paying into this. And what you then get into is people saying, well, hang on, I'm paying for all my private healthcare. Why am I paying the same taxes for the NHS? And then you get into a two-tier tax system, and that becomes a disaster.
Russell, people shouldn't pay twice, surely?
I think if they want to and are willing to, and it alleviates pressure on resource and allows that person the freedom of choice, as Rebecca's actually just setting out my argument entirely, then what is wrong with that? It is a matter of freedom of choice. But again, otherwise, all I'm hearing from Rebecca, respectfully, is an ideological argument. You know, it's not right that we shouldn't this or we shouldn't that. I'm more about pragmatism and practicality and ensuring that by way of innovating and also helping to better organise the NHS, this actually, in terms of charging for GP appointments and also for other services within the NHS, would create two solutions: more money and actually free up resources. It's a win-win, surely.
It didn't need more money. You said a couple of minutes ago the NHS doesn't need more money. So how? And then you're saying they do need. Well,
no,
more money.
Because I'm saying, but Rebecca, I'm throwing your own argument on the left, and forgive me for labelling you as the left, but I'm pretty certain that you are. That all we hear from the left is that there needs to be more money, and it should come from the rich. What I'm suggesting is that the rich, so-called, the middle classes, pay directly without that money actually having to go through the indignity of going through the tax system and then back out again. It's a perfect scenario. Look, the politics of envy, though, I'm afraid, Rebecca, the politics of envy doesn't allow this system to work. Because, of course, those that say they can't afford it don't want others that have worked hard that can to have better circumstances, it seems.
Okay, well, working hard and having disposable income are not necessarily the same thing. Lots of people on very low incomes work very hard. It's not the politics of envy. I am somebody who is a homeowner of a 3-bedroom house in London who uses a private GP. I'm not envious of anything. I am, however, responsible, and I see other people struggling and I worry about those people. So being socially conscious isn't being envious. Many of us on the left, myself included, if I could just finish, very much agree that the NHS needs reform. It is not run efficiently. We are all in agreement that the NHS is not run efficiently. The pay structures don't necessarily work. The trust system doesn't necessarily work. Reform from the inside, absolutely, but don't take away the ability to see a GP at free point of access because people will die.
Well, there we go. Russell, we started with you. Rebecca, we finished with you. Fair's fair. We've run to the end of the debate. Thank you very much for participating. I think we had some really interesting stuff on both sides there. I'd just like to bring in a viewer comment from Nick, who says that in France, people pay €26 to see the doctor. It's going up to €30 very shortly. And it actually makes the system work.